Good afternoon, dear viewers. We are glad to welcome you to our channel, where we always strive to provide you with useful and relevant information. Today, we want to bring up a very important topic that is related to your health. It is pain in the head. Not every one of us feels discomfort and pain in the same area of the head, and this can be due to various reasons. But let's talk about which areas of head pain can indicate serious problems that require attention and medical attention. We'll tell you about the different areas of the head where pain can occur and what symptoms to look out for. After all, our health is our most valuable resource, and it's important to know when to seek help. Let's go over the different areas of the head where pain can occur and try to understand what these signals can tell us. Frontal area. Pain in the frontal area can be caused by a variety of factors, including tension, stress, fatigue, or even the flu. However, sometimes pain in this area can indicate migraines or eye problems. Temporal area. If you feel pain in the temporal area, it may be due to strained neck and shoulder muscles, as well as impending migraines or vascular problems. Occipital area. Pains in the back of the head are often caused by muscle strain, especially when sitting in front of a computer for long periods of time. However, they can also indicate problems with the spine or head blood vessels. Top of the head. Pain at the top of the head can be associated with tension headaches as well as migraines. It can also result from stress, lack of sleep, or changes in atmospheric pressure. Eye area. If you have pain in the area around your eyes, it could be due to tension, lack of sleep, or an allergic reaction. However, it could also be a sign of serious eye or head vascular problems. Remember that each area of the head can indicate a different problem, and it's important to seek medical attention if the pain becomes regular or intense. Don't ignore your body's signals, because seeing a doctor in a timely manner can save your health and prevent serious complications. Let's move on to a more detailed consideration of pain in the frontal part of the head. Feeling pain in this area can be quite common, but sometimes it can indicate more serious problems. Tension headache. One of the most common causes of pain in the frontal area is a tension headache. This condition is often caused by tension and fatigue in the muscles of the neck, shoulders, and head. This pain can be uncomfortable, but it is rarely accompanied by other symptoms. Migraine. Frontal pain may also indicate the onset of a migraine. Migraine is a serious neurological condition that can cause throbbing or severe pain in one side of the head. It can be accompanied by photophobia, nausea, and even vomiting. Sinusitis. Pain in the frontal region can also be associated with inflammation of the sinuses around the nose and eyes. Sinusitis can cause pain in the frontal area as well as the back of the head and nose. Flu and colds. Sometimes, pain in the frontal area can be the result of the flu or a cold. Inflammation of the respiratory tract and sinuses can cause discomfort and pain. Ocular problems. Don't overlook possible ocular causes of frontal pain. For example, asthenopia. Tired eye muscles due to prolonged work at a computer can lead to a feeling of pressure and pain in this area. It is important to realize that if the pain in the frontal area becomes regular, intense, or accompanied by other symptoms, such as visual disturbances, nausea, or weakness, you should see a doctor for a diagnosis. Keep in mind that self-medication can be dangerous, and only a specialist will be able to pinpoint the exact cause of the pain and prescribe the appropriate treatment. Moving on to the next area, let's deal with pain in the temporal and parietal parts of the head. This area can also be a source of concern and requires attention. Cluster headaches. If you are experiencing an intense painful attack, you are most likely dealing with cluster headaches. This condition is characterized by sharp and unbearable pain in the temporal and parietal regions, often on one side of the head. They may be accompanied by lacrimation, nasal congestion, and rarely recur throughout the day. Migraine. Note also that migraine can cause pain in both the temporal and parietal regions of the head. Some people experience increased pain in this area during a migraine. Arteritis. Arteritis is an inflammation of the arteries in the head, often affecting the temporal and parietal arteries. This condition can cause intense pain, often accompanied by redness, soreness when touched, and general malaise. Injuries and strain. Injuries, straining the muscles of the head and neck, and stress can lead to feelings of pain in the temporal and parietal areas. This can be caused by working at a computer for long periods of time, poor posture, or having your hair too tight. If you experience pain in the temporal and parietal parts of your head, and especially if these pains become intense, frequent, or accompanied by other symptoms, such as changes in vision, dizziness, or nausea, seek medical attention. It is important to get an accurate diagnosis and determine the cause of the pain so that appropriate treatment can begin. Let's move on to consider the pains that can occur in the occipital region of the head. This area also has its own characteristics and causes that are important to be aware of. Tension headaches. One of the most common causes of pain in the back of the head are tension headaches. They can be caused by straining neck and shoulder muscles, sitting at a computer for long periods of time, or poor posture. These pains are often felt as a pressing or squeezing sensation. Migraine. Yes, migraine can also cause pain in the back of the head. This may be due to the pain spreading from another part of the head or affecting specific nerve receptors in that area. Cervical spine osteochondrosis. Problems with the cervical spine, such as osteochondrosis, can cause pain in the back of the head. This can be due to compressed nerves or changes in the spinal discs. Arteritis. Arteritis, an inflammation of the arteries, can also affect the occipital area, causing pain. Eye diseases. Sometimes pain in the occipital area can be associated with eye problems, such as astigmatism or strained eye muscles. It is important to note that pains in the back of the head should not be ignored. They can be symptoms of more serious problems such as spinal disorders or arterial disease. If the pain becomes intense, long-lasting, or is accompanied by other symptoms such as dizziness, nausea, or changes in vision, see your doctor. He or she will be able to diagnose and prescribe appropriate treatment to prevent possible complications. One of the most important parts of this topic is to understand the dangerous symptoms that you need to take note of. These symptoms can be signals of serious problems, and their occurrence requires immediate intervention from a professional. Severe and unsteady headaches. If you experience a severe and unsteady headache that doesn't subside for a long time, it could indicate a migraine, cluster headaches, or even dangerous conditions such as a stroke. Focal symptoms. These are changes in sensation, vision, hearing, or coordination. If you notice these changes along with a headache, it may indicate problems with the brain or nervous system. Dizziness and vomiting. If your head pain is accompanied by dizziness, vomiting, or coordination problems, it could be a sign of serious problems, including a stroke. Loss of consciousness. If you feel sick and lose consciousness along with a headache, it requires immediate medical attention. Deterioration of vision or hearing. One dangerous symptom is deterioration of vision or hearing, especially if it happens suddenly or is accompanied by other symptoms. If you experience any of these symptoms, you should seek immediate medical attention. Self-treatment in such cases can be dangerous, and only a professional will be able to determine the causes of head pain and prescribe the appropriate treatment. Do not forget that your health is the most important, and in case of dangerous symptoms, urgently contact a specialist. Dear viewers, thank you for your attention to this important health topic. Head pain can be a signal of various conditions, and it is important not to ignore them. Remember that your health comes first, and in case of pain in a certain area of your head, do not hesitate to consult a doctor. Professional medical advice and diagnosis can help prevent potential problems and improve your overall health. If you have any questions or comments about this topic, please leave them below. And also don't forget to subscribe to our channel to receive more useful information about health and well-being. Your health is in your hands, and we are here to help you be aware and take care of yourself.